My name is Erica, and today I'm going to show you how to use an IV pump to administer IV fluids as well as IV medication. In addition to your IV pump and your IV fluid bags, you're going to need your tubing, both primary tubing and secondary tubing, some saline flushes, and some chlorhexidine swabs. Before we get started, I want to share a little bit of information about the pump that we have. This pump consists of a couple different pieces. This main piece here is what we call the PCU unit, and that's the brains of the pump. That's what controls all the different modules, and then we have different modules that can be added. So this module is your IV module that you can run primary IV fluids through, secondary IV fluids through, and you can connect multiple of these to one PCU unit. You can also connect syringe pumps as well as entitled CO2 monitoring and PCA and epidural modules to this as well. And I will show you how to do that at the end of this video. But first, let's go ahead and talk about how we're going to infuse some primary IV fluids. For today, our physician has ordered our patient to receive normal saline at 50 mLs per hour. So the first thing that I'm going to do is I'm going to get my bag of fluids and my tubing. I'm going to spike my bag and get my tubing primed to get all of the air out. So now I have my tubing open and I have my bag of fluids. First thing I need to do is I need to clamp my tubing, because you need to remember that tubing in its package is unclamped. So I would go ahead, I'm going to double check, and I'm going to make sure that my roller clamp is clamped. This particular tubing also has a section that has kind of a hard plastic covering over it, a blue covering here. That's to protect the stretchy part of the tubing. You can go ahead and take that off. And then I'm ready to spike my bag. So I'm going to take the cap off the spike and just insert it into the bag. I'd already taken the cap off of the bag. Then I'm just going to flip that over and hang it up on my pole. Once it's there, I want to make sure that this drip chamber is about 2/3 full, and I'm just going to do that by squeezing it, and it will get fluid up here in the drip chamber. Here you can see that the drip chamber is about 2/3 full. Now I'm ready to finish priming this tubing. You want to leave the cap on the end of the tubing. It's vented, so it will allow the tubing to prime. And then you would just find your roller clamp. Make sure you're holding that end of the tubing over like a trash can or a sink, not in it, but up high, so that way it collects it and doesn't make a mess. And then you just open your roller clamp, and the fluid will start to come down. And then as it gets to these Y sites, as the fluid gets to here, to these little side ports, you want to turn it upside down for them to fill and then back up. And you would just watch as all of that air is out. You would just go ahead and clamp your tubing. And now that the tubing is primed, you can go ahead and load the tubing into the pump. You're going to do that by opening the door. So this darker blue handle, you'll just lift up on it and that will open the door. And then this blue part, this little blue part of the tubing goes up here in this little groove. Just sits right into there. And then this blue clamp is going to come in. There's a matching blue slot that it comes in down here. And you're just going to insert the clamp into that slot and shut the door. This should have a little bit of wiggle on top. Now once you have your tubing loaded into your pump, you can go ahead and connect that to your patient. I would encourage you to do so, because if you take too long, if you would go ahead and set your pump settings, if you take too long to connect it to your patient, the settings will automatically clear and then you'll have to start over. So go ahead, after your tubing is in your pump, go ahead and connect it to your patient. But make sure your tubing is in your pump. You cannot connect your tubing to your patient unless it's in the pump. It has safety feature in it that will prevent your IV fluids from just free flowing into your patient at a wide open rate. Before I connect the tubing to my patient, I need to clean the patient's IV site. So I'm going to use a chlorhexidine swab, and I am going to clean that thoroughly. I'm then going to flush this IV site to make sure that it's patent. So I'm going to connect my saline flush. Make sure this is unclamped. I'm going to flush that, making sure that it doesn't swell, that the patient doesn't complain of any burning or any pain, and that it flushes easily. Then I'll go ahead and connect my tubing. Make sure that you don't touch that tip, that you don't set it down. If you do, you need to clean that again. And then when you take your cap, off of your IV fluid, you need to go just straight to the IV site. Make sure it doesn't touch anything. If it does, you really should get new tubing. So now that the tubing is in the pump and connected to the patient, we're ready to go ahead and turn on the pump and program it. To turn it on, we're going to use the system on button that looks like a bullseye. Once you push it, the system will warm up and turn on. You can see it's asking if we have a new patient. If you do, you would choose yes, and it would clear any previous data. If you don't, you would choose no. We're going to choose yes. And then it's going to ask you to confirm which profile. If you're going to use the adult or different, it defaults to the last one that was used. I'm going to go ahead and say no, so that way you can see what the other options are. You have other options for adult, critical care, infusion center, NICU, and pediatrics. You would choose the appropriate one, so that way you have the appropriate medications available. So we're going to choose adult, and then you're going to come down here. You see it says confirm. We're going to choose the arrow below it. So now we're ready to program it. The first thing we need to do is select our channel. So that relates to the module that we have our tubing in, because again, we could have multiple of these. So I'm going to choose channel select on the module or on the channel itself, and it's going to open up and give me some options of guardrail drugs, guardrail IV fluids, and basic infusion. You always need to choose one of the guardrail options, as that has safety features built in that are determined by the agency. So that will allow some medications to not be infused at too high of a rate, for example, an insulin drip or things like that. The basic infusion should only be used if you have no other choice, if the medication that you're looking for is not programmed into the pump, and that really should be very rare. And if it happens, you need to notify pharmacy. So you can see I talked too long and the option went away. So I'm going to choose channel select again and come back here to guardrail IV fluids, because we're going to just be running normal saline. Any IV fluids that don't have any additives in them are going to be under this IV fluid maintenance, such as your normal saline, lactated ringers, that type of thing. So you can see here they have other options that have potassium in them. I can page down to see other options, and then can page back up. I can also, so say we were hanging TPN for our patients, we could see there's option for P through T. I could choose that, and I see TPN there that I can choose. I'm going to go back up because we're not giving TPN, we're giving normal saline, and I'm going to choose the IV fluid maintenance. It's going to say, is this correct? I'm going to say yes. And now I'm ready to set the rate and the volume. So I choose rate, and you can see it's highlighted, and I come in and just put in the 50 that the doctor ordered. Then I'm going to come down and do the VTBI, which is the volume to be infused, and I'm going to set that. That's going to be the size of my bag. So typically this will be a 1 liter or a 1000 ml bag. I like to put 900 in here. Some people will put 950. That's okay. Just remember that that bag, you use some fluid to prime the tubing, so I wouldn't put a full liter. Again, I like 900. 950 would be okay as well. And then I'm ready to go ahead and hit start. You can see here, it says the volume to be infused was 900. It says IV fluid maintenance. Volume to be fluid infused is 900. Over here on the channel, you can see that it has a rate of 50. It's scrolling, saying that, oh, it's occluded because I forgot to double check my clamps. So I'm going to hit the silence button, and I'm going to go check that roller clamp and make sure it's unclamped. You'll notice when it's not infusing, and there's an alarm going. There's a red light on top, and you can see it's telling me occluded patient side. So I knew that it was below the pump. So I found that, and now I can hit restart, and it should start to infuse. Yep, so now it's telling me it's infusing at 50. It's telling me what is infusing, and I have my green light. You can see I have an A here because it's channel A, which corresponds to A over on the pump. So my patient also has an order to receive cefazolin, 1 gram, so I'm gonna get that ready. So I have my secondary bag of cefazolin, and I have my secondary tubing. The secondary tubing comes with a hook that I'll need to lower my primary IV bag, and I'll do that in just a minute. Again, the tubing comes unclamped, so make sure you clamp it. You always want your tubing to be clamped before you spike the bag, otherwise when you turn it over it will just run on through. So I'm going to take my cap off and spike my bag. Again, I've double checked to make sure it's clamped. Then I'm going to turn this over. We're going to prime this a little bit differently. We're going to prime this in what we call back priming. So I'm going to take fluid from this primary bag and use that to prime my secondary. Of course, to do that, you need to make sure that your primary IV fluids and your medication are compatible. So first I need to get a ChloraPrep so I can clean my tubing, and I'm going to be cleaning the primary tubing. So I'm going to come to the pump, and I'm going to go backwards, working up towards the bag, and I'm going to find the first injection port that I can connect to. So I'm going to clean this off with chlorhexidine for at least 15 seconds. For today, I'm not counting since it's not real. Then I need to make sure that nothing touches that since it's been cleaned. And then I'm going to take the cap off my tubing, making sure it doesn't touch anything. If it does, I would need to start over, and then connecting the two. Now to do the back priming, what I need to do is I just need to hold the secondary bag lower than this primary bag. And what will happen is as I open this clamp, the fluid will come into the bag. And I want to just keep going until I have all the air out. I also want to make sure that my drip chamber is about 2/3 full. In this case, in order to get all the air out, I ended up getting a little bit more in the drip chamber than I wanted. If it gets too full, it can be hard to see the drips falling. So in order to fix that, all I have to do is turn my bag over so it's upside down with my drip chamber on top, and just squeeze a little back into the bag. And then flip it back over, make sure again it's about 2/3 full. Then I'm going to hang my secondary there, and I am going to lower my primary. And you need to lower it all the way. So you want this hook fully extended. Now that I have my secondary tubing primed, I'm ready to go ahead and set my pump. So the first thing that I need to do is I need to do the channel select, so that way the PCU unit knows which channel we're changing the settings on. So I'm going to do channel select. It will come up and show me my primary settings. This is also how you could change these primary settings in case you needed to. So if the doctor ordered a rate change, you could come in here, choose rate, and change the rate. This is where the silent button is. That's always good to know. We're not changing the primary rate though. We're going to add a secondary, so we can see where it says secondary down here, and I'm going to choose that. And again, I told you the order was for cefazolin, so I'm going to choose the A to E option, because there are a lot of medications in here and I don't want to scroll to find them. And then I'm going to choose the C, and I can see cefazolin. So I'm going to choose the cefazolin, and you can see I have several different options. I have 1 gram per 50, 1.5 gram per 50, and I have 2 grams per 100. I do also have an option to put in my own concentration, but you should have what you need. And again, I said our order was for 1 gram, and it is a 50 ml bag. So I'll choose that. It'll ask you to confirm that. So you want to confirm that with your order as well as with the medication itself. So we'll choose yes. So just another spot to confirm that I have 1 gram and 50 mLs and my dose is 1 gram. Then I can choose next down here. And then it has the rate already programmed for me. You can see it has a rate of 100 mLs per hour, a volume to be infused of 50, which means that it's going to take 30 minutes for this medication to infuse. You, as the nurse, need to know that that's correct. I'm going to go ahead and hit start so I don't lose this information, because if I talk too long, I will. So I'm going to go ahead and hit start, and you'll see that it'll start to infuse. So make sure that you look up your medications before going to give them so you know how long that IV piggyback can infuse over. So some may say 30 to 60 minutes, and then if it's set for 30, you could slow it down if you needed to, if your patient had a very frail IV site or if you had another reason to slow it down. But now that this is running, the very first thing that you should do is you should come and check and make sure that there are drips falling in the secondary chamber. So you're going to come up here and look at your secondary and see if drips are falling. I don't have drips falling. I'm going to guess I have drips falling here in the primary, and yes I do, and I believe that's because I forgot to unclamp my tubing. So I've unclamped the secondary tubing, and now you can see that drips are falling from the secondary. So you can see that it's falling there, and here at the primary it's not. It's very important when you're setting a secondary, when you hit start, the next thing that you need to do is double check and make sure that drips are falling. Before you hit start, make sure your clamp is unclamped. When it's time to document how much fluid your patient has received, you can get that information off of the pump. So we would come in and check the intake off of the IV pump as well. I personally like to do it with the pump paused because I don't like the numbers to be continually changing, but you can do it with the pump running as well. So to pause the pump, you come over here on the channel or on the module and hit pause. It will turn yellow up here because it's in standby. And then now I can come over here onto the PCU unit and I can see where it says volume infused. I can choose that. It's showing me the total volume infused is 12.14. I can also change this so it's the primary secondary volume separated. If I do that, depending on what my secondary was, maybe I want to have that separated so I know that there was 6.8 of primary, 5.3 of secondary. After you have that documented, you would just hit clear all and then come back over here and restart your pump. To get back to the main screen, you would just choose the option that says main screen and it will take you back. This pause and restart is what you would use if you would need to put your IV fluids on hold for any reason, if you needed to stop them temporarily while you were giving some IV push medications or anything, and you would just hit restart. I want to show you an example of how the guardrails are programmed for patient safety. So let's say that the physician ordered to increase the rate of these IV fluids to 250. For whatever reason, maybe the patient's very dehydrated, maybe their blood pressure is a little low, says let's increase the IV fluid rates to 250. So maybe I didn't remember that the secondary, and I didn't notice that the secondary is still running. So if I choose channel select and come in here to change the rate, and I'm like, oh, the rate has changed to 250. And I hit start, I get a message that says that exceeds the guardrail limits of 200 mLs per hour for the cefazolin. And that's when I go, oh shoot, that's not what I wanted to change. So I'd say no, I don't want to proceed, and that would take me back. It defaults here to where it wants me to change the duration. If I choose rate, it's not wanting to do anything. But then when you come down here, you'll see an option for rate and volume. So I just change that. It comes back to the rate. And I'm going to put that rate of my cefazolin back to 100. I can change the rate of the primary while the secondary is running. However, I just need to make sure that I'm choosing the primary. So again, I'm going to do channel select, And I can see here it's telling me the secondary information. I don't want that. So I'm going to do setup. And now I have an option for primary. So I'm going to choose primary. And now I come back here to have the rate of 50, which was originally ordered. So I can change this to whatever the order change was. And do start. It says, do you want to stop the secondary and infuse the primary? No, I don't. When you're ready to turn the pump off, because either the order's been discontinued for the fluids or the patient's being discharged or for whatever reason, first you would want to go ahead and clear all of your volume from it to make sure that you have that out. So again, I'm going to pause because I like to pause. I'm going to do my volume infused, document that, hit clear all, and then to turn the pump off, I have to turn the channel off. So since this is the only channel that's running, when I do this, it will shut the whole system off. You just have to press and hold it for about 3 seconds. And when you let go, it will say powering down and it will shut the pump off. So I did want to show you how to take these modules on and off. They all work the same way. So if you can do one of them, you can do the other. So if I needed to take this module off, maybe it needed to get repaired, maybe it was an extra one, it was a syringe pump and I no longer needed it or something like that. How I would do that is there's a dark kind of colored button here. It's the same color as this handle, a dark kind of blue-ish gray. I push it in and hold it, and that will just release it and it will come off. To put the new one on, I need to kind of bring this up at a high angle and then it will snap into place. That is how you set up a primary and a secondary IV fusion using this IV pump. Thank you for your time.